Hello, my name is Dr. Geoff Warburton, and I'm going to talk to you in this video about ways in which you can support yourself if you're grieving. What's the right way to approach grief? There is no right way to grieve. There really isn't. The way we all deal with grief is as varied as our personalities, and the kind of support we need is varied too. You may have heard there are stages of grief that we all go through. This is a myth. The originator of the stage model, somebody called Elizabeth Kubler-Ross, identified it for people who are dying, not people who are grieving. It's been adapted to fit grief without any significant evaluation. In fact, you do not need to apply any model of stages to help you through your grief. Grief is not linear. It's not a process you just pass straight through. What might help me? What has been identified through research is that there are two psychological things that help us with grief. The first is being open to however grief arises in us. The second is developing compassion to bear the pain of it. So, what do I mean by being open? I mean putting aside your opinions, your rules, your codes of behaviour, and your thoughts about how grief should look, and letting your grief take its course in its own way. And what do I mean by compassion? I mean developing tenderness, acceptance, and kindness for your pain. We really need this. Grief can feel excruciating at times, as if it might tear us apart. But finding compassion towards ourselves is the safest thing we can do to get through the pain. How do I get over grief? We don't need to try and get over grief. If we try and get over it, we'll only give ourselves extra stress on top of what is already a stressful experience. Things need to be emotionally resolved as we go through grief. It's more likely to happen if we just let the grief be. If we leave well enough alone, simply let ourselves surrender to how grief is showing up, we can discover that grief is not something we have to get through to get back to life. Our lives go on by embracing grief, not interfering with it. How do I manage my emotions? Grief is usually an emotional roller coaster, but how many of us have had the experience where we tell ourselves, if I let myself be emotional, I will not be able to function? The thing is, we seem to be more likely to become dysfunctional if we numb our emotions. We're much more likely to develop anxiety, depression, addictions, obesity, and even become aggressive if we numb our emotions. It may not feel so safe to be with our emotions at work, but if so, we must find a space and time outside of work to acknowledge them. If we reach out to others about our emotions, it's a great thing to do. We don't need fixing by others. We just need them to listen and acknowledge what we're going through. We don't need cheering up about our grief. We just need others to witness our pain. And we don't need people to help us move on, because that doesn't actually work. We just need people who acknowledge exactly how we are. What if I become depressed? How many of us associate grief with depression or the blues? Well, they're not the same thing at all, and shouldn't be treated as such. In over 30 years of working with the bereaved, I never met a soul who found the treatment for depression the solution for grief. Depression is when we lose a love of life, Depression can be a reaction to grief, but we need to let the grief flow rather than treat the depression. If you're seriously clinically depressed, then medication may be able to help you. However, there's no recognized evidence that medication is a solution for grief. There is evidence, though, to show that antidepressants numb a sense of vitality. There is also evidence to show that grief is a normal human part of life that most of us are equipped to deal with without medication. How long should grief last? There's no time frame for grief, nor is there any need to move on from it. Grief can last a lifetime, and usually does in some form or other. But this is not a bad thing. Grief connects us to the love we have for the ones we've lost. It can be painful, but it's not bad for us, and it needn't get in the way of life and living. The more we embrace grief, the more likely we are to feel more alive, not less. What should I expect from my manager? Well, you're entitled to compassionate leave following the death of a loved one. Check out your local human resources policies about this, and your manager should be able to help you. Talk to your manager about how much time you may need off, and before you take any leave, talk to them about the ways in which you would like to keep in touch. Let them know how much information about the death and the grief can be shared with colleagues, and talk to them about what support you might need when you're back at work. Do I need professional help? Well, there are times when it might be helpful to get some professional help. This is especially so if the grief is traumatic. Now, by traumatic, I mean that the grief is overwhelming your sense of being able to deal with it. Now, signs that this may be happening are sleeping difficulties, you got panic or anxiety attacks, flashbacks, images in your mind about the circumstances of the death, having uncontrollable outbursts of anger, or you're avoiding people and places out of fear. We can't normally heal that on our own. But just remember this: there is no right way to grieve. Only your way. There's no set amount of time, and there's no authority that can really say what is healthy for you, including this video.